Observed every February, National Children's Dental Health Month reminds families that children should adopt good oral health habits early, and this improves the chance of children having healthy teeth and gums throughout their life. Oral health is a window to our overall health. Here to tell us more is our friend, Dr. Danny Steckler from Pediatric Dentistry. How are you doing today?
I'm doing well. Thank you for having me.
Absolutely. We're very excited to have you on the show. So first, tell us more about National Children's Dental Health Month.
So every February is National Children's Dental Health Month. It probably should be every January and March and April and all that.
Probably should just all 12 months.
Yes, but we recognize it in February, which is nice. But I think a lot of schools will kind of use that time to use that as a curriculum to help kids during that time as well. So
absolutely, just a good yearly refresher.
Sure.
How important it is to brush your teeth.
Yes.
And floss, of course.
And floss, of course.
Yes. So what is the advantage of taking your child to a pediatric dentist?
So more than anything, it is an environment that allows kids to thrive. Not that any other dental office can't do that. It's just, and it's more about the environment. Of course, you know, myself and my staff are kind of trained just because we talk with kids and see kids often, that it's just a little bit more of a comfortable place for them.
Right, because kids are a whole different ballgame than adults, per se.
Kids are a whole different ballgame. The anxiety levels come out a little different in kids. So.
Oh, absolutely. I know my anxiety levels still come out, and I'm 22.
Okay.
So what's the max age y'all take?
So I see young adults till about 21. Most of the time, if they get into something that is a little earlier than that we have a great dental community here in Lexington, that we have tons of people that we refer to. We have tons of good general dentists in town as well, and a lot of good pediatric dentists as well. So it's just Lexington has a great dental community.
Yeah, absolutely. That's fantastic. So how often should you take your child to the dentist?
So it's recommended to do that twice a year, and that's more for staying on the preventive side of dentistry. It's always easier to prevent certain things from happening or to catch them early than to be reactive, because usually the treatment gets a little bit more involved when you wait a little bit.
Yeah, okay. And so where can viewers go to find more information?
About my office, you can look me up online, of course, or anything like that. But also the American Academy of Pediatric Dentistry has a website where you can find specific questions or answers to specific questions that you might have. So that's a pretty good resource for sure.
And what's your #1 tip for kids that you see the most often that they struggle with, that you just want them to know? Flossing, brushing their teeth, any certain tip you have?
Sure, I think kids will just do what they want to do when they want to do it. So
Agreed.
A lot of them don't want to brush their teeth. I mean, a lot of kids, parents will ask their kids to go brush their teeth before bed, and they'll go up to their room and play possum. So, so the main thing is just, hey, you're the parent, you're the guardian, help them survive or thrive in a way that stays on the preventive side of care. So brush and floss, and of course, twice a day is what's recommended.
Right, because as much as you'd love to see the kids come into your office, it's best if it's just for a checkup and not a cavity.
It's always better when for the kids and the parents and the guardians, when it's an easy visit. Yes, absolutely.
Well, wonderful. Thank you so much for coming on the show today. We really appreciate it. All great tips.
Well, I appreciate it. Thank you for having me, Jane.
Absolutely.
All right.
And we'll be right back after this.